Hi, my name is Mickey Soloff, and today's date is July 1st, and I will be giving my first case presentation about HIV. Here is a typical patient presentation with a patient who has HIV. So a 25-year-old male presents to his physician with an unexplained body rash. He discloses that a sexual partner was recently diagnosed with HIV. He has been experiencing flu-like symptoms for the past 2 weeks. His physical exam results showed swollen lymph nodes, a low-grade fever, and a mild body rash. HIV is a virus which attacks the body's immune system. HIV stands for Human Immunodeficiency Virus. So some causes of HIV are through blood-borne pathogens. This can be acquired through IV drug use, through blood transfusions, through heterosexual and homosexual intercourse, and from mother through child. This is called vertical transfusion. Vertical transfusion might occur across the placenta, in the breast milk, or through direct contact during or after giving birth. Here is some background information on HIV from a worldwide perspective and from in the United States. These are amounts of cases which has been documented. Worldwide, there's 35.3 million people who are living with AIDS or HIV. 2.5 million of those people were newly infected with HIV and AIDS, and 3 million deaths occur each year by AIDS worldwide. In the United States, 1,201,100 people who are the age of 13 or higher are living with HIV or AIDS. 47,352 people are newly infected with HIV in 2013. This is the most recent data. 78 of those cases have been between men with men, which is men with men sexual intercourse. 25% of those cases is heterosexual intercourse, but these cases are mostly from women, not from men. There are a cumulative number of 658,507 deaths which occur by AIDS. There are a few risk factors which increase the chance of a person getting HIV. One of these risk factors is sharing injection equipment. Another risk factor is unprotected sexual intercourse. This is more common when a person has many sexual partners or if the person is gay or bisexual. Another risk factor is passed on from mother to child, and this is called vertical transmission, where it might occur from breastfeeding or breast milk, from pregnancy or from the placenta, and from birth, which is through direct contact during or after birth. So what is the normal function of the body to fight off infections? So normal T cell function is when helper T cells attack viruses by releasing antiviral proteins, which then attack the infected cells. So what does HIV do to the body? HIV attaches to the CD4 receptors and enters the host T cell. Then it releases HIV RNA and enzymes into the host cell. HIV reverse transcriptase copies these viral RNAs as proviral DNA. Proviral DNA is an inactive viral form that has been included into the genes of the host cell. This proviral DNA enters the host cell's nucleus, and the viral enzymes of the HIV help the proviral DNA integrate into the host DNA. The host cells then produce HIV RNA and HIV proteins. These HIV proteins are assembled into HIV virons. Virons are infected forms of virus which are outside a host cell. These HIV virons are then budded from the cell surface. HIV protease, which is an enzyme that breaks foreign proteins and peptides, divides these viral proteins, which converts the immature viron to a mature infectious virus. These mature infectious viruses then go on to the rest of the T cells in the body, killing all other T cells, which help the body fight off infections. This makes the body more susceptible to illness and infections. So here is a simplified version of what I said in the previous slide, and this is a picture version of the HIV life cycle. So you can see on the left-hand side, it starts with viral penetration, and that's when the HIV binds to the CD4 receptors. Then reverse transcription happens, where it copies the viral RNA as proviral DNA. Then you see in the nuclear entry that proviral DNA enters the cell's nucleus. Then it goes to integration. Integration is when the proviral DNA integrates into the host's DNA and produces HIV RNA and HIV proteins. Then viral assembly happens, which is the proteins are assembled into HIV virons. And then you could see in the next picture of migration to cell membrane, these virons are going towards the cell membrane. Then it is created, it is created and the budding occurs, and you can see from there on there's immature HIV virons and mature virons, and the cycle and the process happens all over again. Here you could see the comparison of different cells. On the left-hand side, you have a normal T cell, and on the right-hand side, you have an HIV-infected cell. And you can see those HIV virons being budded from the cell surface. There are 3 main stages of HIV, and with each of these stages comes different symptoms. So the first stage is acute HIV infection, and symptoms are shown 2 to 4 weeks after the infection. Some of these symptoms are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes and mouth ulcers. These are typical symptoms when a patient is fighting off an infection, and during the acute HIV infection stage, your body, that's when you're first introduced to the HIV virus, and so your body is fighting those off. The second stage is chronic HIV infection, and this can last from 8 to 10 years. During this stage, there may be asymptomatic symptoms if you are treating your HIV. The last stage is AIDS, and this is when your HIV progresses to AIDS because there's an abundant amount of those cells which are turned into HIV, and so your body is so depleted of T cells that it increasing number of illnesses, and you can develop major infections. And usually if you get to the point of AIDS, unfortunately a patient can end up dying. So just like with the symptoms of HIV, there are different stages, so too there are different stages for diagnosing HIV. So stage 1 is the acute phase. This is when the CD4 count is greater than or equal to 500 cells. And in a normal person, it's 500 to 1,200 cells, which is the normal CD count. So this is when the body is first being introduced to the HIV virus, so the cell count is a little greater than 500. This is due to rapid multiplication and spread because it, again, as I said, it is the first introduction of HIV, so it spreads really fast. This is why symptoms show 2 to 4 weeks after the infection. This is also viral replication of P4024 antigen in the blood. So stage 2 is clinical latency. This is when the CD4 count is 200 to 499 cells, which is a lot lower than in phase 1. This is when the cells continue to multiply, but at lower levels, which is why it can last 8 to 10 years, or maybe longer than that, and there's not as much symptoms because the body starts producing antibodies, which lowers the viral load. And the viral load is how much virus is in your blood. But if this goes untreated, it can destroy CD4 cells completely. And this is when it leads to AIDS. AIDS is when a CD4 count is less than 200 cells. This means that there is not enough T cells in your body to fight against infections, which this majorly weakens the immune system, which can cause infections and a lot of other illnesses. And usually, unfortunately, those infections and illnesses result in the patient's death. If a person thinks that they have HIV and they have symptoms for it, they should definitely go get tested. There are a few different tests that a person can do in order to determine if they have HIV or not. One of those tests is NAT, which is the nucleic acid test. This is a blood test which looks for viruses, which is the viral load, which is the amount of virus that is in the blood. This test should be taken 10 to 33 days after the exposure of HIV. Another test which is an option is antigen test. This is a blood test or a finger prick, and they look for P24 antigen. Another one, which is actually the most common used to diagnose HIV, is the antibody test. And this antibody test tests blood or oral fluid for antibodies of HIV. This should be done 23 to 90 days after the exposure of HIV. Now, if someone does have HIV, they have to make sure that they go get their viral load measured all the time to keep sure that they're monitoring that HIV so that it does not turn into something which could be problematic for the person. Unfortunately, there is no cure for HIV, but with treatment, HIV can be livable. One of those treatments is HAART, which is highly active antiretroviral therapy, which is a combination of medications which help control someone's HIV. This reduces the viral load, so it makes it non-transferable between different people or sexual partners or injecting equipment or from mother to child. So there are some preventions that people can take in order to prevent HIV from happening. One of these is PrEP, which is pre-exposure prophylaxis, which should be taken before intercourse or injecting of drugs. And the second one is PEP, which is post-exposure, which should be taken after intercourse or injection of drugs. And of course, one of the easiest ways to prevent HIV from happening is by the use of condoms.